Eyes.
Yeah, so hey, this is Ty-Ron. How you doing, everybody? And I am with Dr. Wong, and I'm at the Lavish Laser on East 83rd Street. And look, I'm gonna get a couple of shots, Botox, and relieve some of my stress. I'm taking some of my stress to bed with me, and subconsciously, probably frowning. So this is all kind of preventative. So he's gonna get rid of all this in here and a little bit in here. And look, if you come down, you see Dr. Wong and Leslie, and you mention my name, they're gonna hook you up and give you a little discount. All right. So look, I'm just gonna keep this running, and you're gonna see Dr. Wong stick me a few times. And then a few days later, everything relaxes. How long does it take?
It will take 72 hours
72 hours. So
before you see any real change.
okay, so by Christmas Eve, the day before Christmas Eve, I should look amazing. 72 hours. And then this will be gone. And I'll be looking cool like I normally look. So right now he's loading the syringe, and there it is.
All right. So we have the Botox.
Alrighty. I'm going to go right in here.
Let's work on your so-called 11 lines.
Oh, okay.
And your bunny lines here.
Yeah. That's that bunny thing.
Exactly.
There.
That's what they call them, bunny lines there.
Okay. Bunny lines.
Let me just clean you off a little.
Yeah, because I got some foundation on, because you know I like to look camera ready. But camera ready and needles is not a good combination. So he's got to put some alcohol there. So you're going to raise my brows too, right?
Yes.
So I can look like...
I'm going to raise your brow as per your request. Go like that.
Yeah.
Yep.
Yeah, good. Okay. And don't be cheap. Like, load me up. I don't want my forehead to move.
Does it make a mad look first? Let me just see here. Yep. Okay, relax. At least I know where these muscles have been overly done. A little pinch here. Good. Pinch again.
And believe it or not, it really doesn't hurt. But if Leslie was in here, she'd be crawling the walls. But it doesn't hurt.
Good. Just massaging a little bit.
Right.
Alright, so now this is going to be a little tender because it's right around the nose here, but just a little bit here. Super. I'm going to round you just to get the other side.
Okay. So Dr. Wong, you're on Instagram, right?
I am.
You are. So tell everybody your Instagram.
Actually, the address. I have to. Let me concentrate on this here for a moment, please.
Okay.
Thank you, though. Super.
Good. It's probably something like Dr. Wong, but.
Great. Let me do that here.
That's great.
We're nearly finished. You're doing great.
Okay. And this side here.
Yep. And I'll clean you off afterwards.
Okay.
Super.
Cool. And I hate needles, but it really is not painful. It's a little pinch, and he knows how to go in the right angle, so it really doesn't hurt at all.
Now it's going to be obviously a little swollen because we added the medicine, and it's, it'll turn red tonight. But the effects will take place within 72 hours.
Cool.
So what we did today, we'll work on your 11 lines, the mad lines, as some people would say. The bunny lines here. And we're going to do your eyebrow, the lateral eyebrow lift will go up.
Good. Excellent. So I look like I got a happy face.
Yes.
I don't look like I'm frowning, even though some of my clients make me frown. And then later on, we're going to go in here, right? And what goes in here? What can we do here in order to bring that out? Because I'm losing volume in here.
So usually with volume, that means you have to add something back in. So usually probably be a derma filler, or we could add volume by another technique called the PDO threads.
Okay. What about fat? What about fat transfers? Do
That's
you do
another
that as
option,
well?
yes.
Because then fat is you just keep it, right?
So that's another option, that's for sure, yes.
I think I want my own fat.
So, and it's possible that another way is that we have a proprietary technique where we take your own blood and we could turn it into your own customized gel.
Okay.
And then we could actually use it as a filler.
Okay.
So it's using your own blood.
Right.
We will make it into a gel consistency, and return it to the area where it's avoided. In this case, around the nasolabial fold.
Right.
And it's for you specifically because it's your serum in your blood.
Right. Now, how long would that last?
I've had patients lasting over a year.
Oh, really? Okay.
Yes. So it's and regular derma fillers are usually maybe 6 to 9 months.
Okay. Okay. So it has a little bit more longevity. And what about fat? Does the fat actually stay alive? Like, I mean, like,
yes,
what is
that's but the trick or the tricky part about fat transfer is that fat is not dead tissue; it's alive. So when we extract the fat from one area of the body to the other, there's a chance that during the processing of the fat cells, that they may die off inadvertently. And then when we don't know which one's alive or dead, and then when we transfer it, it may take or not take it. Because that's why it's called a fat grafting. It's just like if you're grafting organs.
Right.
You want to see if it's going to take or not take.
And then you may have to build on it and do it again.
Correct.
Okay, cool. Well, there you go. Well, I'll check in with you in about 3 days, and then we'll see if I have these anymore. We're going to say goodbye to these for a while. All right, see ya. Bye.